Welcome to The Explainer. Today, we're diving into something that literally affects every single person with skin, but man, is it wrapped in a whole lot of misunderstanding. We're going to uncover the realities of skin cancer, pulling straight from the insights of practicing plastic surgeons. But hey, fair warning here, we aren't just looking at the medical side of the equation. We've got some genuinely shocking revelations coming up about your wallet and some seriously hidden loopholes in cancer insurance. It's a medical and financial double whammy that's absolutely going to change how you look at that little spot on your arm. So let's kick things off by challenging a huge assumption most of us probably make. If you've got a spot on your skin that's tiny, I'm talking just 1 single millimeter in size, and it's totally flesh-colored or maybe kind of red, but definitely not black, is it safe? We've been so conditioned to freak out over massive, dark, scary-looking moles, right? But what if the spot looks like absolutely nothing to worry about? Keep that thought in the back of your mind as we unpack today's source material.
All right, Section 1, 3 myths about skin cancer. Time to shatter some illusions. Let's look at 3 of the most dangerous myths out there. Number 1, that skin cancer only goes after the elderly. Look, while it's definitely more common in older folks because of, decades of soaking up the sun, the data shows us it absolutely does not discriminate by age. Number 2, that a spot has to be pitch black to be cancerous. Our sources stress that you really can't judge a book by its cover, and you sure can't judge a malignancy just by its color. And number 3, that it has to be this huge, noticeable mass. Come on, we've all gone down that midnight internet rabbit hole, scrolling through terrifying photos trying to self-diagnose. But the reality, a spot as tiny as a single millimeter can absolutely harbor cancer cells. Size and color, they just aren't the safety nets we thought they were.
Moving on to Section 2, diagnosis and correct treatment. Let's see how the actual experts handle this. When a specialist looks at a suspicious spot, they follow a really specific clinical protocol. Step 1 is a dermoscopy check. This uses a specialized magnifying tool that lets the doc see right beneath the surface of your skin. Step 2 is a super crucial boundary marker they call the golf ball rule. Basically, if the lesion is smaller than a golf ball, they might go one route. But if it crosses that threshold and is larger than a golf ball, that triggers Step 3. For those bigger masses, doctors have to rely on much more intensive imaging, like MRIs and physical biopsies, to actually confirm what it is before they make a move. Now, once a diagnosis is made, or even if it's just strongly suspected, we hit a massive pitfall. A lot of times, patients try to treat an annoying red peeling spot with topical ointments or hormone creams. And here's the crazy part, the cream might actually make it look better for a bit. It creates this super dangerous illusion of healing. But make no mistake, the underlying cancer doesn't just disappear. Our sources are crystal clear here. The absolute primary, definitive, first-choice treatment for skin cancer is surgical removal. A plastic surgeon's main goal is to accurately diagnose it and literally cut it out with proper, clean margins so it can never come back. Section 3, 3 directions cancer spreads. Here's exactly how this cancer moves around. So it turns out skin cancer has very specific spatial directions it likes to travel, and knowing this completely flips how you view a simple skin lesion. Dr. Umera breaks the danger down into 3 main directions. First up is horizontal. This usually starts in the stratum spinosum layer and just spreads outward. Honestly, it might just look like some annoying peeling skin that you keep obsessively putting lotion on. It might even seem to get better with hormone creams, but it just keeps peeling and coming back. Second is vertical. This one starts in the basal layer, literally the very bottom of the skin. And third is distant. That's your classic, terrifying metastases we associate with melanoma, where the cancer basically jumps to entirely different parts of the body. I want to dive a bit deeper into that second direction for a second, the vertical spread, also known as basal cell carcinoma. This is where things get incredibly visceral. Because it starts at the very bottom layer of the skin, its main feature is this devastating vertical destructive power. It just dives straight down. Our source points to some seriously terrifying, real-world clinical examples of this. Like, a seemingly small, completely non-black spot on a patient's head can literally eat a hole straight through their skull. If it forms on the nose, it can burrow down and completely destroy the upper jawbone. It doesn't have to look massive on the outside to be causing profound, terrifying destruction underneath. Section 4, the cruel cancer insurance trap. Brace yourselves, because here comes a major financial bombshell. Let this sink in for a moment. Typical skin cancer is not covered by standard cancer insurance. You might have bought this really comprehensive cancer policy or one of those 3 major disease policies, totally assuming that if a doctor drops the C word on you, you're financially protected, right? Well, the hard, cold truth from both the medical and insurance fields is that general skin cancer is almost entirely excluded from these standard policies. The real kicker is understanding exactly where the insurance companies draw the line. So what is covered? Usually only malignant melanoma, the one that spreads distantly. But what isn't covered? Squamous cell carcinomas and those highly destructive basal cell carcinomas we were just talking about. Just imagine this nightmare scenario. A doctor biopsies a 1 mm spot, definitively diagnoses you with cancer, and tells you it's currently eating into your skull bone. But then when you go to file a claim, the insurance company denies it because it's just basal cell skin cancer, not melanoma. Seriously. If you get a stomach cancer diagnosis, the policy usually pays out immediately upon diagnosis, even before surgery. But for skin cancers that don't fit that incredibly narrow melanoma definition, you probably won't see a single dime for the diagnosis itself. Now, your separate surgical policies might cover the actual procedure, but the cancer payout? Denied.
Section 5. Early detection and plastic surgery. All right, it's time to take some action. Okay, take a deep breath. I know that a combination of bone-eating vertical cancers and massive insurance loopholes is a lot to handle. It's heavy, but hey, knowing about these loopholes puts the control right back in your hands. So here is your battle plan. First, yes, you should absolutely still watch for sudden new black spots. That's always going to be a red flag. Second, and honestly this might be the most important takeaway, beware of the horizontal spreaders. If you've got a patch of red, peeling, or irritated skin that just refuses to heal after 1 or 2 weeks of using over-the-counter ointments, stop waiting around. Do not let it give you that false illusion of healing. And third, bypass all the guesswork and consult a plastic surgeon immediately. Getting an expert to actually do a dermoscopy and cleanly, surgically remove the threat is absolutely your best physical defense, completely regardless of what your insurance fine print says.
Which leaves us with one final, incredibly vital question. Think about your own skin right now. Is that stubborn little spot on your arm, or your nose, or your scalp really just a dry rash? Or, now that you're armed with the knowledge of how these hidden cancers actually operate and the strict limits of your financial safety nets, is it time to pull out your insurance policy, read the fine print, and make an appointment with a plastic surgeon? Don't let a 1 mm illusion compromise your health.